The eThekwini Municipality will close all community COVID-19 vaccination sites on public holidays over the Christmas and New Year's weekends. Now, this includes the mobile beachfront pop-up sites. It says the sites will close on the weekends of the 25th to the 27th of December and on the 31st to the 1st of January. The closure is due to low turnout and also the increase in the infection rate among health workers brought on by the fourth wave. However, the municipality has encouraged the public to register to get vaccinated, as it remains the most effective defense in reducing severe illness and death. To unpack this further, we're joined now by eThekwini Community Services Deputy Manager, Mr. Musa Gumede. Babu Gumede, a very good afternoon to you. What is it that informed your decision to eventually decide that you're actually not going to be vaccinating during some of those very critical weekends?
Good afternoon, Tammy. We have noticed over the last few weeks a drop in numbers of people who are coming forward for vaccination. We have also noticed that the number of health workers that have been infected has also been increasing in the last few weeks. We've therefore taken a decision that the two types of sites, we have community sites and we have got permanent clinics. We've taken a decision that the community sites, which are community halls, pop-up sites, where the numbers are very low, would close on holiday days. That means on the 25th, the 26th, and the 27th, they'll be closed, and starting afresh on the 28th to the 31st, and then taking a holiday again on the 1st, 2nd, and then coming back on the 3rd. This is to give an opportunity for nurses as well who are infected, just to deal with the issues that they have, but also to make sure that when we come back on board, we are fully ready for what is ahead. This does not mean that the clinics and the 24-hour service, community CHCs will close, and hospitals, where hospitals vaccinate, they'll continue vaccinating as per normal.
So really, it is the community sites that were out of kilter, not part of the usual process. About how many people have actually gone through those various community sites since this vaccination campaign began for this festive season?
At the peak of vaccination, when the over 60s and above were vaccinating, when the only group that was open, we're getting up to 9,000 people in some of the sites per day, and then it tapered to about 7,000 a week. In the last week, ending on the 22nd, in eThekwini, which was Wednesday, in eThekwini, were 2,419 people who had vaccinated in that week. So you can see the drop since the beginning, that we're now per week seeing 2,419 of people. And in the pop-up sites, for instance, along the beach, they are seeing about 5 per day. So in terms of the use of human resources, we believe that the numbers do not justify a full open vaccination throughout that period.
Do you believe that the pop-up sites, specifically those along the beach, can you confidently say that they were a success or not so much?
At the moment, there's a general hesitancy, and especially among the young ones coming forward, and those are the people who are mostly at the beaches. And therefore, I wouldn't generalize for the over 60 and over 50, but below that age group, those are the people who are mostly at the beach, and those are the people that are not coming forward at the moment.
And what are the learnings that you can take from this particular exercise? You know, should COVID still be a problem for us come this time next year, what will you be doing differently? Because 5 people vaccinating at the beach, that is dismal.
Yes, we may need to take another step back, look at whether there are any incentives that you can put forward for especially the young people. Secondly, we know that universities are opening, and they've taken a stance that whoever comes onto their campuses needs to be vaccinated. That may mean that we need to change where our sites are to support that stand of the universities. We also need to ensure that the reasons why they're not coming forward are dealt with. Mostly they are related to what is on social media and the myths that are out there in the public space. So we need to deal with those myths.
And how do you plan to do that? Because that is a mammoth task. It's the reasons why there are levels of vaccine hesitancy, and it really does go beyond the eThekwini, community services, but it's very much of a national and even a global issue.
It needs a lot of stakeholders getting involved, from churches to community leaders to everyone, including our celebrities. Most young people interact a lot with celebrities, and therefore they need to be in the forefront. They need to spread the correct messages, and we need to dispel any myths that are out there so that those they look up to lead this campaign.
You've mentioned that the temporary sites for the 25th, 26th and 27th of December will be closed. They'll be closed for New Year's Eve as well as the 1st of January. What is your strategy for the new year? You mentioned there perhaps looking at universities. How are you going to be targeting young people who are going to be going back to universities in 2022?
Obviously, when after the results come out in the matriculant results, we usually see lots of queues outside universities. We may need to have a discussion with universities whether we could target those people who come looking for spaces at the universities. And secondly, those that would have been, who would have received call-ups to go to universities, as the universities have decided that only vaccinated would come in, we would need to be involved in ensuring that we were ready to meet the demand by those that want to go back to universities. But also because it takes time to vaccinate fully, they need to start now. We encourage them to use their holiday period now to come to our sites, start vaccinating so that there is no push close to the dates of going back to universities. Remember, you need to take the first dose and then 42 days later a second dose, or earlier if there's agreement to take it earlier. So they need to start now and planning for going back, those that are going back to tertiary. But the general youth that are not necessarily taking that route, we continuously use all platforms to speak to them, to deal with the issues that are coming up. The controversies that are up there do not assist, but we try and deal with them through all media that is available.
Before I let you go, Musa Gumede, one of the other reasons, apart from the low uptake from the general public, is the level of infection that's continuously increasing amongst the health care workers. Talk to us about this and why and how it informed your decision to withdraw the health care workers. How rife is the infection due to Omicron?
I think the statements that have been out in the public domain in the past few days about the changes that are taking place and the reasons for the changes, especially of quarantine, indicate that we are now dealing with a community spread phase of the epidemic. And during the community phase of the epidemic, there are things that we are doing that no longer make sense now. A lot of our health workers have been exposed due to some of the things that we've been doing. For instance, they've been following up on contacts, going to people's homes, and therefore with the condition being community spread, they've also, some have had mild disease. They're not seriously ill like in the first phase. They've got symptoms, some of them, but are mild, and therefore we are giving them an opportunity to heal from those. So it may help to understand that we are now dealing with a community spread, meaning every second person next to you probably has to be treated as if they've got this Omicron variant because it is so widely spread. So it means everywhere you are, you can't separate a contact now from a general member of the public. Almost all of us are exposed at the moment, and therefore The only positive thing is what scientists have said, that the virulence or the impact in terms of seriousness of the condition has been mild. I think that's the strength that we have. That we must come to vaccination is our only, call it a spear or shield, both a spear and a shield that we can use to actually attack, to reduce the numbers and to protect as well.
Mr. Musa Gumede, thank you very much for that update regarding the closing of the community pop-up sites that have been put up in eThekwini for vaccination during some of the weekends from the 25th, 26th and 27th of December, which is the Christmas weekend, as well as the 1st of January and the 31st, which is New Year's Eve and New Year's Day. That's Mr. Musa Gumede, the eThekwini Community Services Deputy Manager.